Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Fibroadenoma. Fibroadenoma is the most common benign tumor of the female breast. It is most commonly seen in the age group of 50 to 30 years. It is also known as breast mouse. On etiology of fibroadenoma is here you will see that there is increased sensitivity of focal areas is seen. There is increased sensitivity of focal areas of breast tissue is seen to the estrogen. Then on pathology, in the pathology of the fibroadenoma, here you will see that right in the pathology of fibroadenoma, this fibroadenoma is actually an encapsulated spherical lesion. As the name says, it contains fibro means it contains fibrous tissue. Obviously fibro is fibrous tissue and adenoma stands for glandular tissue. So this is a tumor containing both fibrous tissue and glandular tissue. Origin is it mainly originates or arises from the interlobular stroma, and these stromal cells through which it originates, these can be either monoclonal or it can be polyclonal also. So fibroadenoma is an encapsulated lesion and it will arise from the interlobular stroma. It can be monoclonal or polyclonal. It contains fibrous and glandular tissues. Then types of fibroadenoma. In fibroadenoma we have pericanalicular, which is hard type of pericanalicular, which is a hard type of fibroadenoma. Here there is proliferation of the connective tissue is seen, and this proliferation of connective tissue is seen inside the elastic lamina. Then we also have intracanalicular. In intracanalicular is inside the canaliculum and it is actually soft and it occurs mainly because of the proliferation of the connective tissue outside the elastic lamina. Then now clinical features of fibroadenoma. In clinical features, a patient with fibroadenoma will present as painless mass and it is actually a slow growing solitary mobile lump in the breast. Thus, it is seen as a breast mouse. Then diagnosis of fibroadenoma. So in the diagnosis of fibroadenoma, here the patient, we have to ask the patient to go through a mammography to make sure that there is no, to exclude the other causes. So on mammography for a fibroadenoma you can see presence of popcorn calcification is seen. Investigation of choice for fibroadenoma is FNAC. Then treatment of fibroadenoma. In the treatment of fibroadenoma, there is no treatment is necessary for fibroadenoma. We can do excision biopsy is actually the treatment of choice. Excision biopsy is the treatment of choice for fibroadenoma. Especially it is the treatment of choice for suspicious lesions. And it is also treatment of choice for cosmetic indications.
thank you and thank you for watching.